So yeah, for the next drug of choice that I'll be looking at is the pharmacology of what epoprostenol. Pharmacology of epoprostenol. Now, this drug, there's a sequence by which we'll be looking at it, where we get to look at the mechanism of action, mechanism of action, administration, pharmacokinetics, indication, and adverse effect that this drug can actually have on us. All right. So from the overview, we said that this drug, known as what epoprostenol, is a prostacyclin. All right, or you could say it's a prostaglandin I2. All right, it is actually a vasodilator. When they say something is a vasodilator, if you say this is the size of a blood vessel, that means if you take this drug has the ability of making that blood vessel as big as this, dilating it. Okay, so it's a vasodilator, and that means it will make a blood vessel bigger, and it will also what inhibit platelet aggregation. You know that when clots wants to form, many platelet have to actually come on each other and all of that. You get, so this drug will actually what inhibit this. Okay, so what's the brief pharmacology? This epoprostenol works by directly vasodilating both pulmonary and systemic arterial vascular beds. Okay, and this will now help to what reduce blood pressure in these areas, right? So it also inhibits what platelet aggregation, thereby it will reduce the risk of what clot formation. All right, so what is the administration route like? How can one administer this drug, right? So it is typically given via continuous intravenous infusion, right, due to its short half-life, which we'll get to look at the half-life. All right, so you get to see that what they always write intravenous use, right? Although this one is, you can see via intravenosa, is actually a different language that is written on this paper, but you can just spot out the intravenous use, right? What's the pharmacokinetics? It is rapidly what hydrolyzed and is subjective to some enzymatic degradation. Okay, subjective to enzymatic degradation. Distribution, it has a short life of approximately just 6 minutes. All right. Metabolism, it forms 2 active metabolites with minimal activity and 14 inactive metabolites, right? So what is the excretion? It is excreted mainly through urine, that's about 84% through urine, and to a lesser extent through feces, about 4%, right? Half-life, just about 6 minutes, all right? So it has a very, very short half-life, all right? So looking at the indications, that's in what disease condition will you actually use this drug in. It is indicated for treatment of pulmonary arterial hypertension. So if there's a pulmonary arterial hypertension, you can use this drug, right? Using it to improve exercise capacity and delay disease progression, right? It is often used in patients with class 3 or class 4 symptoms, okay, who do not respond adequately to conventional therapy, okay? What are the adverse effects of this drug? The adverse effect can include things like headache, nausea, diarrhea, jaw pain, flushing, and more serious side effects can include things like what bleeding, low blood pressure, allergic reactions. Okay, so guys, that's it for the pharmacology of what epoprostenol.